doctors and hospitals affected healthcare costs? And how will the new healthcare reform help or hurt this problem? The increased liability on doctors and hospitals affect the cost of healthcare.
Well, I think most everybody understands that the threat of lawsuits does push up the cost of medical care because the doctor practice is almost out of fear. If you go to the emergency room now and your child has a bump on the head, if it were a doctor's kid, they would send the kid home and watch him a little bit and probably not spend any money. But if you take him to the emergency room, the doctor's under the gun. You know, there's one chance out of a million that he could miss something. He has to get an MRI. And it's just endlessly. You can't leave the emergency room without a $10,000 bill. So it is the intimidation. Now I have a proposal, a piece of legislation that would deal with this, and that is to take it out of the hands of the attorneys. The attorneys like it, and they won't accept this bill because, you know, I think about half the people in Washington are attorneys. But the bill that I have says that it's sort of like a no-fault insurance. The doctor and the patient pays for this bill, and they agree on the arbitration panel. So if the patient comes to me and she's pregnant, having a baby, we buy an insurance policy that will pay for a bad outcome. It's sort of like your car insurance. You pay for bad outcomes, and you don't fight over this, and the attorneys don't get in every time there's a fender bender. So if there's a bad outcome, you go to the arbitration panel, and you've already agreed to this, and the attorney's not there. The money goes to the patient and none to the attorney. Today, all the money goes to the attorney, and they scare the wits out of the doctors and pushes up the cost. The problem is those contracts are not legal. If I have a contract with my patient and we agree to arbitration, they throw them out of court. They say, "Oh, you can't do that." But it's back to the basics. Just legalize contracts. Voluntary contracts is really a foundation of free market. So that would get around a lot of this litigation and really drastically reduce the cost of medical care.
I'm a former federal tax litigation attorney, so I did trial work, and I'm for tort law. It is awful to see what's happened in our medical system because of tort law. And really what's happened is that people have been hurt because of this. Is there a reason to go after people who've been negligent? Yes. But again, that's contract law that you can bring into place. But this is how it's impacted people. Ron is an OBGYN. Today in the United States, about 12% of OBGYNs just say, "I'm not going to practice anymore. The malpractice insurance is too high, it's too much grief, I'm not going to practice anymore." There's 49% of all counties in the United States have no OBGYN because people don't want to be practicing. If you look at neurologists, 75% of neurologists say they will refuse to operate on children. They're not going to operate on children because the malpractice is just too high. People are impacted by this, and we're crying out for reform. We really can't have medical reform without lawsuit reform.